governors were CECMs for health. So maybe it's a good omen to be CECM for health. Welcome back, Claire. Dr. Ganda was telling me I don't look like a politician. Hii maneno inakaa maneno ya deputy governor inakaa ni ya politicians. And I want to agree, however, what I normally say is it's high time our brand of politics changed a bit. It is time to have some truthfulness in our politics, some candid discussions. Na unajua mimi nilikuwa mtu wa baba. But somehow now I find myself to be a member of the two-term movement. And however, that's why I'm saying politics need to change. I still need to ask my president, what do you mean when you say outpatient in level 4 is free? Because as much as we want our people to clap for us and give us the votes, we also need to discuss how is that going to be sustainable. So we need clarity on these issues, and I believe these are the right forums to discuss such gray areas. And it's all for posterity. It's all for the good. It's not about attacking or undermining or chasing the votes away. So I am glad to be here. Let's interact. Let's mingle. Let's come up with good, actionable points and move on. Thank you very much.
Good, thank you. As I wait for that slide to be put up, let me first of all thank the leadership and the secretariat for the work that they've done. I know we've had a lot to do over the last several months, several meetings, several issues to be sorted out. Let me look for, what's your slide? But we've been able to succeed in getting this done. I'm waiting for the slides to be put up. I'm looking for a copy also of myself. This is a problem of having many phones, Yeah, many gadgets and phones. So I'm wondering which one. She sent it to the one which is only used by my wife, so I don't know. Have you put it up? So I think I'll start with the resolutions for the last meeting. The first key issue was the impact of the US government work stop order on health service delivery that was discussed in that meeting. And the resolutions were that counties were to implement mitigation measures to cushion against the impact of the US stop work order on health programs, particularly HIV, TB, and malaria, and to ensure planning and budgeting for the donor-funded programs to sustainable service provision. This has been a very difficult thing because I think we took it up at council. We had meeting with senators and parliamentarians to try and find a resolution. So it has not been an easy ride. Somehow, some of those things have been taken back. They released some of the funds for us to be able to continue, but nobody knows what's going to happen tomorrow. And so that transition. So the status update is that the counties are at various stages of integrating HIV, TB, and malaria into county health service delivery, and malaria is going to be a disaster if we don't do something about it, because most malaria funds were gone. We're just very lucky that some of the interventions take long. Once you have been given bed nets, the bed nets will last for 3 years or 4 years. But then after 3 years, you'll need to replace those bed nets. So we'll start seeing that impact if we do nothing about it in the next few months, next few years. The US delegation had an engagement with the government, the MOH, CoG, in August 2025, in which there was a commitment towards continued support of the USC government programs in a phased approach within the current financial year. Nobody's telling about the next financial year. And I know at DHA we have a problem trying to get Kenya EMR to be taken up by us. We have a problem getting the right institution to take over the HIV mandate and the financing for it, because when you say counties take over, you take over using what? Because the biggest amount of money is again HR. The second issue was the county preparedness, oh good, it's now there, for BRES project. And the counties were encouraged to sign implementation partnership, which I think most counties already did.